There's lots of surgical treatments available here. Probably the most important thing that we do is Mohs surgery, which is a very advanced type of skin cancer surgery that Dr. Allen, my colleague, performs. You have to have a specialized advanced training beyond the regular dermatologic training to be able to perform this procedure. And it allows very precise removal of skin cancers so that we are certain when the patient leaves the door that they will never have a recurrence of that lesion again. What's so amazing about Mohs surgery is that it's a tissue-sparing type of surgery. Before, if you had a basal cell, we needed to take a 6mm margin all the way around the lesion. And to close that lesion, it had to be 3 times longer in order to close it into a straight line. So if you have a lesion this big, the scar is going to be this big. But now Mohs surgery allows us to take a rim of tissue right around the skin cancer, look at it immediately while the patient is still in the clinic, and determine if that cancer is completely gone. If it's not, you can go back just in a localized little mapped area and take what's left of the cancer without creating this huge hole of taking out normal tissue. So it really reduces the scar, it increases the sensitivity of the surgery so that the patient, when they leave, they know that the cancer's gone because the physicians looked at it right then and there. So it really gives the patient security, but it also gives them less of a scar, and everyone wants that. What's so exciting now is that we have Dr. Mills on staff, and she's a board-certified dermatopathologist, which means she's a pathologist that has specialized in evaluating skin biopsies only. So she can look at a lesion under the microscope after we've done a biopsy and give us a diagnosis. It used to be that we had to send the pathology out. It took many days to get it processed, and then a pathologist somewhere else would read it, and then we would get the report back in, and weeks later sometimes we would call the patient back and say, this is what's going on, this is what we need to do. But with her being in-house, it's usually just a turnaround of a few days at maximum. She can also come to the providers and say, this is what I see. So you can let the patient know that we're still processing. It's going to take a little longer to get the result back. So it lowers the anxiety level of a lot of patients. And she's a brilliant, brilliant dermatopathologist. So we know that when we get that diagnosis back, that it's accurate.